Good day everyone. So for today's video, it is all about the simulated videos for the care of the pregnant mother, the vaginal delivery procedure in the care for the newborn. So the first procedure that we will going to do is all about the care of the pregnant mother. So the first thing to do for this procedure is you must first identify the client and then explain the procedure to the client and then instruct the client to void or empty the bladder. Then assess the client to the dorsal-recumbent position and then drape client to provide privacy and then expose the abdomen of the client. Then after that, wash hands to avoid contamination. Then after you wash your hands, then for the first maneuver, you must lay both hands gently on top of the mother's abdomen. Then press inward in the upper portion of the abdomen. So the nurse must observe 3 points, which are the first one is the relative consistency, and then the shape, and then the mobility. Then, for the second maneuver, place your hands in each side of the mother's abdomen and apply gentle but deep pressure. So, on the both sides of the mother's abdomen. So if there's no resistance, the fetus is in a longitudinal line, and if there's resistance, so it is in the transverse line. So with the use of the one hand, apply pressure on the side of the abdomen and palpate the opposite side with the other hand to determine for the back and front of the fetus. So place natin itong other hands to the other side of the abdomen, and then ang other hand tapos nato to the other side of the abdomen. And then i-press nato para ma-determine nato ang front and back sa baby or sa fetus. So for the third maneuver, gently grasp the lower portion of the abdomen above the symphysis pubis, so with the use of the one hand. So if there is a hard noodle, so it is the head that is presenting part. So if it is soft, so it is the buttock presenting part. Then move the grasping hand from side to side if the presenting part is non-movable, so it is already engaged. And if it is movable, so it is still floating. So dire lang dapat sa ubos, nato siya ma-feel. So for the fourth maneuver, so the nurse faces the patient's feet. So dire ata magtanaw sa tail sa atang patient. So standing alongside and places both hands of the abdomen about 2 inches above the Pupper's ligament. Then press gently downward the direction of the birth canal. So, ano natin siya? I-press lang natin siya gently. So, then drape the client then drape the client and reposition comfortably. So after that, we must wash our hands after the procedure. So the next one is all about the vaginal delivery procedure. So in this procedure, we must first put our surgical mask and then surgical cap, and then after that we must do the scrubbing. So the scrubbing of our hands. So after that, we must put our surgical gowns, and then we must do the gloving. So the close gloving. Then after that, we must set in front of above the lower part of the patient, in front of the vagina of the patient. Then after we sit on the front of the patient or the lower part of the patient, so we must check the perineum. So if the perineum bulges, protect it with operating towel or gauze. Then check and record the delivery time and gender of the newborn with the circulating nurse or midwife. Then pat the baby on the abdomen of the mother. Then wait until cord pulsation stops, then apply 2 clumps. And then cut the cord between clumps. Then deliver placenta when signs of placental separation occur by rolling the cord around the clump. Inspect placenta for completeness of cotyledons and for abnormalities. If placenta is complete, remove clamp attached to the cord and place placenta on container. Then, inspect vagina and perineum. So, place the baby in prone position over the mother's abdomen. Then rub back lightly, it's to stimulate crying, and then immediately rub the infant dry. Assess newborn's hemodynamic status, and then check temperature of baby through rectal route. Insert the rectal thermometer 1/2 inch into the rectum of the baby. After 2 to 3 minutes, take the reading of the thermometer and note down. Then it's time for the baby to take a bath. First, we must put on the buds on the ear of the babies to prevent water comes from the baby's ear. Check the temperatures of the water. Then put gently a small amount of water on the baby's head. And then put a soap on the baby's head. Then rub it in the water softly. Then it's time to put a diaper on the baby. Then it's time for administer for vitamin K, because vitamin K is essential for the formation of clotting factors 7, 9, 10, which are responsible in preventing bleeding. Vitamin K is synthesized in the intestinal tract through the help of the intestinal flora. And vitamin K is given to neonates after delivery as supplementary in order to provide protection. So, the last one may administer sa bata is called Credis prophylaxis. So, kani siya is gina-administer niya siya sa bata to prevent the newborn's eye against ophthalmia neonatorum. So, ang ophthalmia neonatorum is the acute purulent conjunctivitis of newborn usually due to gonorrhea infections. So, ginabutang niya siya diri adapit from inner canthus to the outer canthus. So that's all the video that is all about simulations of the care for the pregnant mother and then the vaginal delivery procedure and the care for the newborn. So thank you for watching and I hope you enjoy watching it. Thank you everyone.